Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in just a few minutes in a Going Deep segment brought to you by CO2 Lift. Today we're featuring Sarah Viebrock, a registered nurse specializing in aesthetics. She is the MedSpa Director at Austin Plastic Surgeon, and she specializes in aesthetic and liposuction procedures. Now, liposuction is one of the top three most requested aesthetic procedures. In recent statistics, it overtook breast augmentation as most popular cosmetic surgery. The contouring procedure, which uses suction to remove excess fat, accounted for 15% of cosmetic surgeries performed worldwide. Changing trends are also part of a global surge in aesthetic medicine, which saw over 30 million surgical and non surgical procedures carried out in 2021. And that's a jump of about 20% from the previous year. Who would have thought that lipo would end up being so popular? Sarah Viebrock joins me now to talk about the best liposuction procedures, the benefits of carbon dioxide therapy pre and post procedure, most importantly, how CO2Lift Pro is speeding up the healing and recovering process in dramatic ways. We'll also get patient testimonials and reactions to CO2 Lift in real time. Welcoming now to the show is the amazing nurse Sarah Viebrock. Welcome to the show, superstar.
Thank you so much for having me. I'm so excited to talk about one of my favorite topics, the CO2 Lift mask, and how we combine it with body procedures, just like you alluded to.
So let's dive right in. When did you first hear of CO2 Lift products? And in your own words, can you describe how carboxytherapy functions on a cellular level? And what does it actually help your patients achieve?
Absolutely. So let me speak first to how it actually works, because I think then that will make sense to how we heard about it. Carboxytherapy, or the CO2 Lift mask, uses carbon dioxide, and why that's important is it's basically going to trick your body or your tissue, wherever we're applying this mask, into feeling like it's starving for oxygen, right? Oxygen is so important for many things: healing, getting nutrients to our cells, all of the above, right? So if we can temporarily trick our cells or our tissue into thinking that it's starving for oxygen, then our body's going to say, hey, we need more oxygen, right? So it's going to obviously open up those capillaries, which is what feeds our blood, right? Our blood vessels, they feed our blood to the tissue, and it's going to send fresh oxygen-rich blood to that tissue wherever we applied the mask, which is going to do a couple of things. It's going to speed up healing. It's going to bring the nutrients that we need. It's going to help to close a wound if we're applying it over a wound. It's going to hydrate. It does all these amazing, incredible things. So that's where we, heard about this. Dr. Franco, who I work for at Austin Plastic Surgeon, actually started incorporating this into his liposuction cases, his high definition lipo cases, especially. In aesthetics, we're always trying to be at, the top of what's new and cutting edge. And the CO2 Lift mask really helps to decrease downtime, because patients don't want downtime, right?
Right.
We want to
It's one of the important questions. Downtime is at the forefront of everybody's brain. And what you're saying, it makes total sense. Carboxytherapy, if you increase the presence of wound repair factors and growth factors, that helps cells turn over faster. So the science is the science is the science. Now, the healing process is key. So let's go back to what you just alluded to. How does CO2 Lift Pro affect the recovery process?
Exactly. So, and like you said, that's what the patients are looking for. They want to look better, but they want to speed up the healing, right? So anything we can do to make our tissue healthier, speed up that healing. And that's what we're doing with the CO2, right? So we're getting fresh oxygen blood, which is what that means is we're getting more nutrients. We're getting more collagen made, right? We're getting faster wound healing. And the fresh blood is also removing waste from the area, right? So literally by increasing nutrients, getting more waste taken away, we're speeding up the healing process, decreasing bruising, decreasing redness, decreasing inflammation, and just literally cutting that healing time, I would say, almost in half.
I love it. I love it. And the research is there. This is clinically verified and clinically researched. CO2 Lift Pro and even CO2 Lift, the consumer one, definitely improves that local metabolism, and elimination of waste products within the body is key to what backs it up, and inflammation ensues. So this helps the body heal localized damage such as scars and bruising so much faster. So I love that you're applying it to these localized areas other than the face, which is the most common go-to use case for CO2 lift. But now we're seeing we're seeing this incorporated pre and post surgical procedures, which I find fascinating. Now, what are the most common procedures you combine CO2 Lift Pro with?
So we started out incorporating it in those liposuction cases, the HD lipo, even some of Dr. Franco's BBLs, but we saw how it was really decreasing the bruising, decreasing the downtime. So I was like, I got to get in on this. So for me, lower body is my jam. I treat a ton of cellulite. I do a procedure called Ovally. That is a minimally invasive one-time treatment for cellulite. And then I also do a ton of skin tightening, especially with the weight loss revolution. We're seeing so much increased skin laxity. And a lot of times we're doing it what we call a luxury legs procedure, where I'm combining Ovally with skin tightening and then finishing that with that CO2 lift mask. Because when we're doing these minimally invasive procedures, we have a little more bruising, a little more inflammation. It's non-surgical, but it's still minimally invasive. So
Yeah.
the patients, when they hear non-surgical, they expect low downtime, right? So
Yeah.
as soon as I started combining this, their downtime is significantly decreased and the patients are happier.
I love happy patients. So let's chat Avali because you mentioned that and that's piqued my interest. So we know that liposuction won't treat
Mm-hmm.
cellulite.
Mm-hmm.
Cellulite is a complex problem and pockets of fat are only one contributing factor. Liposuction cannot alter the fibrous connective bands that, along with the fat, cause the dimples and bumps associated with cellulite. And it's important to note that liposuction can actually worsen the appearance of loose, saggy skin. So for the best results, the skin in the treatment area, and I learned this from Dr. Franco, should be firm, smooth, and relatively elastic. And using liposuction to remove fat from an area of the body with looser, saggy skin can leave the skin looking even more wrinkly. So the next recommended step is Avali. What does this procedure involve on a scientific level? And when you combine it with CO2 Lift Pro, what are the difference in results with patients who have not used it?
Yeah, absolutely. You're speaking my love language. I love to talk everything ovulate and cellulite. This is really how I differentiated myself as a provider. We know that 90% of women have cellulite, and they've oftentimes been burned by a procedure in the past that didn't work because we didn't truly understand it, right? So now we know, just like you said, that cellulite is caused by those fibrous bands pulling on the skin and creating that dimple. So if we don't go in and release the band, physically actually cut the band, then the skin won't smooth out. And like you said, removing excess fat with liposuction actually makes skin laxity worse. And I would say the majority of my patients that I'm treating for cellulite also have skin laxity. So that's where what we call luxury legs comes in, where we're treating not only the skin laxity, but also the cellulite, because most of us have both. It's a one-time treatment that we do in office for the ovule. We numb you locally. I go in with the ovule wand and actually cut those bands. And then the best part is the verification. So I can go through with the hook on the wand and make sure that I got all those bands that are tethering your skin down. And then the best part, like you said, is we use the CO2 lift mask immediately after. So I'm literally applying it on the booty and the thighs, everywhere that we're treating. We leave it on for at least 45 minutes to an hour. And then I send those patients home with 2 more because I want them to do at least a series of 3. And the feedback that I've gotten from my patients that I've incorporated this with is I have almost no bruising. I mean,
Wow.
that's incredible when we're talking cutting and releasing bands in the butt and thighs. So,
Oh,
so
yeah.
it's been a total game changer. Not only do they have a smooth booty, but they can get in that bikini even faster.
Oh, I love this. This is so validating. Now, in parallel, I'm going to pivot a little bit. Both CO2 lift and hyperbaric oxygen therapy utilize oxygen in their respective processes. This we know. In CO2 lift, carbon dioxide is applied to the skin, and the skin is expected to absorb this CO2 and, in the process, release oxygen, potentially, but we know now factually, improving skin health. And in a hyperbaric oxygen chamber, pure oxygen is administered at increased atmospheric pressure. Now, this higher pressure allows the body to absorb more oxygen into the bloodstream, which can be beneficial for various medical conditions. Now, the common thread between the two is the focus on oxygenation of tissues, albeit through different methods. So, comparing CO2 lift to a hyperbaric oxygen chamber suggests that there may be some similarities in how both treatments incorporate the use of oxygen. So the CO2 lift product has in fact been compared by even Dr. Hoyos and a lot of other fellows in your practice in your field to this
Right.
hyperbaric oxygen chamber. Can you speak to this in your own experience with patients?
Absolutely. You know, in the world of aesthetics, we are so excited for anything new and cutting edge. We mentioned that earlier, right? And we've used hyperbaric oxygen therapy for a while to speed up wound healing, to speed up the recovery process, which is everything we've already touched on, right? And just like you said, it does that via oxygen with increased pressure, but it's not convenient, right? Like the patient has to go and sit in a chamber for minimum 45 minutes, often up to 2 hours, sometimes longer, right? It costs quite a bit. It's not cost effective. They can't do it in their own home typically, you know, unless they've got their own chamber at home, which is rare. Um, so they're both increasing oxygen, right? We already talked on why that's helpful. But with different components, right? So one is a topical mask using CO2. The other one is increased pressure, which is going to help you absorb more oxygen. So I totally agree. And that's what we've seen with the patients. And with a patient maybe that was a little bit slower with healing that we would have sent to a hyperbaric oxygen chamber in the past, now we can just apply the CO2 mask and send them home with more of them to do in the comfort of their own home. Way more cost effective, so much easier, and the results are incredible. Just like you said, this has been scientifically studied. We see the increased oxygenation, we see the sped up healing, we see it with, right before our eyes. So it's totally mind blowing. I would say that it's very comparable, but in my opinion, better because
It's even better.
it's so much easier.
Yeah, and I'm actually not quite certain statistically if the hyperbaric oxygen chamber in fact contributes and aids the neoangiogenesis, because I mean that's something extremely localized to the mask application. So you're right. I think that this takes number one.
Absolutely. Like you said, it's exactly where you need it, right? We're going straight to the source.
Yep. Well, we are officially out of time. Can't wait to listen to those patient testimonials. I think we should roll up our sleeves and see what they have to say. What do you think we do it?
I can't wait. Thank you
All right.
so much for having me, Zen. This has been incredible.
All right, let's head into the practice and see what Sarah's patients have to say about the CO2Lift Pro mask. Let's dive right in.
My name is Daniela, and I'm 23 years old.
My name is Cecilia. I'm 30 years old, and I got Vivace treatment done.
I visited Sarah here at Austin Plastic Surgeon to address some cellulite that I had on my butt and back of my thighs, basically my whole life. So I did the Ovally treatment here with her.
What's the main reason you visit Nurse Sarah at Austin Plastic Surgeon? And in your opinion, what's the most important consideration when you evaluate skincare treatments?
So I always go to Sarah because she really knows my skin. I've been going to her for a while now. And so I like that whenever she suggests something to me, it's really customized to my skin.
In terms of general skincare, I really look for something that's rejuvenating, something that's going to hydrate my skin, keep my skin nice and glowy, something that's really soothing and just feels nice on the skin.
I really want to invest in products and treatments that are really actually going to work for me. And she is the best person because she's not going to, sell me something that's not going to be useful for me or my skin type. It's really about getting to my goals, and Sarah definitely does that.
Have you ever heard of carboxytherapy for skin rejuvenation before? If so, what do you know about it?
I had never heard about carboxytherapy for skin rejuvenation before, so I was really excited to try it out for the first time.
So I didn't hear about it until Sarah recommended it to me. I was a little bit nervous going into Vivace since I have very sensitive skin. I am prone to a lot of redness, and I don't want to come out of the clinic looking crazy for a long period of time. And so she highly recommended it, and I'm very, very happy that she did since my results were very, very quick and very, very nice right after my treatment.
What were you expecting from this CO2 lift treatment?
So really what I was expecting, just to help with a little bit of the redness, maybe a little bit of the soothing aspect of it.
I knew from Ovally treatments from other patients that sometimes it could cause pretty intense bruising. So I was hoping it would help with that.
How has using the CO2 lift mask before or after your procedure improved your recovery and results?
It just made it a lot easier. It was really nice that I could get the Vivace done, which is microneedling, so it can be a little bit spicy in certain areas. It was really nice that she put that on immediately after my Vivace treatment, and I had it on for a while, and then I was able just to peel it off and go on from my day to day.
Using the CO2 mask after my Avali treatment was absolutely game-changing. When I came into the treatment, I was a little apprehensive just because I had heard that other patients had had really intense bruising that lasted anywhere from 2 to 3 weeks. But for me, that absolutely was not the case. I used 3 treatments of the carboxy treatment after my Avali, and I only had bruising that lasted a couple days.
Even hours later in the day, even the next day, I noticed that I didn't really have as many noticeable fine lines, especially in this area. I was just a lot more plump and a little bit more shiny. So it was a really, really good treatment.
How does the mask feel on your skin?
The mask is really, really nice. It has this really nice soothing and cooling effect. Because it's kind of a jelly consistency, you can either pack it on to areas that you need a little bit more treatment, or if you're trying to make it spread a little bit more, you can make it a little thinner and get really nice results that way too.
It feels so nice. It's honestly really cool. I think it's something that people don't really talk about. It gets a little bit puffy and it's almost like a gel consistency. So it feels really nice. It's nice and cooling. And then you can just kind of peel it off when you're done.
What are the most apparent results after your CO2 lift treatment?
By far, the most apparent and impressive results I had after my CO2 treatment was the absolutely minimal bruising that I had after my Avali treatment. I was really apprehensive going in just because I had seen some patients have really intense bruising, and that for me was not the case at all with the CO2 lift.
Oh my gosh, I had 0 redness after Vivace, which is crazy for me. I have very sensitive Irish skin, so I had no redness after I peeled off the mask. Soothing, it was really, really nice in my skin. I could touch my skin and there was no sensitivity. And then again, I was just very plump with it. So my skin just looked really good. It looked like I got done with having a facial rather than having like a microneedling session.
Is this a mask you would use again for post-treatment healing?
For everything, yes, absolutely. Anything that's going to cause me to get red, anything that's going to cause a little bit of sensitivity on my skin.
I would absolutely use this mask after any treatment here at Austin Plastic Surgeon. And I'm also kind of excited to try it on my face, either on a weekly or monthly basis, just to see how it promotes skin rejuvenation, a glowing skin, and a nice hydrated skin.
That was our Going Deep segment brought to you by CO2 Lift. That was the awesome nurse Sarah Viebrock, MedSpa Director at Austin Plastic Surgeon. You can check her out directly on the gram at Sarah Injects Austin. That's Sarah with an H. You can go directly on their website at austinplasticsurgeon.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2Lift.com.